Good morning, people. It's about 5:30, I think.
5:20 to 6.
Yeah, I pretty much not slept. So it's had a few hours, but the pain in my tummy is just getting unbearable now. So we are now at the hospital. We've just parked and we're about to go get seen and praying that they can do something because it really fucking hurts now. I can't push my hernia back in at all now, and my whole tummy is just
Swollen and
a complete
distended.
swollen mess. And even just driving here has been agony because of the slightest of bumps, and it's just horrific.
And it has been horrific, I have to say.
So it's just sorting out my oxygen now, and then we're going to go over there and hope that they can do something to help us. Because if they can't, I don't have a freaking clue what's going to happen, because this is not livable. Not at all. So, fingers crossed, they can help us.
So guys, we're in the hospital, as you know, and we're in a little room in the A&E bit, been seen by a nurse, which I'll tell you about in a minute, but first of all, we got in, spoke to the receptionist and said that she's got a hernia that won't go back in and it's causing a lot of pain, and so the receptionist put question mark hernia on the thing, and we were just like, great, if that means that we're not going to be seen as quick, because she didn't put anything about pain or anything, then, you know, who knows. But luckily it wasn't too long before the nurse called us in, and she said Charlie's name, and then she just walked straight over to a room without sort of waiting for us or anything. And the rooms, like the first set rooms you go into, they've got sliding doors that go into like the walls, and she didn't even open the door fully, so I had to open the door for Charlie because the nurse just went in and sat down. And then she was asking her questions and stuff, and she wouldn't let Charlie answer the questions. And well, first of all, when I first went in there, she was just like, "Oh, are you her daughter?" And I was like, "No, I'm her wife." It's starting to piss me off.
I just think there's only a few years between us.
Yeah, it's starting to really piss me off that people see that she's in a wheelchair and that she's got pale hair, because I don't know whether they look at her and think that the pale hair in the wheelchair means that she's got to be old. I don't know. But just because she's blonde and in a wheelchair does not mean that she's my mother. It is really peeing me off. So she made that, and I was just like, no, I'm her wife. Thank you very much. And then she was asking Charlie questions. She didn't ask Charlie what oxygen she was on. She just saw that the last time she was in, she was on 2 litres, and she didn't ask if that had changed. Oh, she just assumed. Yeah. She just assumed that Charlie was on 2 litres when she's not. Obviously, she's on 4. And just like, yeah, not letting Charlie answer the questions and stuff, whatever.
Comment about the fucking oxygen.
Oh yeah, commented about the fact that she was just like, why have you got 3 on the back of your chair? Because we bought all the cylinders. Because I'm a dumbass and I forgot to charge her machine. So we used the machine in the car, but obviously we bought all the cylinders just in case. I mean, as it is now, we're attached to the wall, but that's another funny story. But yeah, she was just like, you've got 3. And I was just like, what are you talking about? Then she was just like, why have you got 3? You're only on 2 litres. And we were just like, no. And even if she was only on 2 litres, as it turned out, she didn't even offer to plug Charlie into the wall, so I had to do it on my own. When we got into the room, she told Charlie to get onto the bed and then left. Didn't ask if she needed any help to transfer. and she left the brakes off of the bed, on the top of the bed. So when Charlie transferred over, the bed fucking moved. So far, this has not been a good experience. I mean, I'll turn the camera around in a second and show you guys Charlie's tummy, and you've seen what Charlie's tummy is like normally, and it is just getting bigger by the minute. So hopefully we'll see a doctor soon, and then we can start getting this sorted.
This pathetic amount of morphine.
Yeah, they gave her like the tiny weeniest little amount of Oromorph. And obviously, as you guys know, she has Oromorph at home, and lately she's been having it more and more, like as much, like maybe not as much as she's prescribed, but like she's getting towards having the amount that she's prescribed. But yeah, I mean, she's in so much pain. It's just so far not a good experience. We've had some, I was going to say lovely experiences here before, but we've had some lovely nurses and everything. So far, not impressed. So I'll show you her tummy so you can see it, and then we will update you as we go on throughout this experience.
Actually, weren't they?
I don't know. Oh, sorry guys, I did not mean to do that. I might get Charlie, or me, if I'm the one editing it, if I can, to take that bit out. If not, I apologise. I was just shuffling my glasses up my face. Basically, still in the hospital, as you can tell. We've seen one doctor who poked around at her tummy, and basically he's sending her up to the surgical assessment unit because there's, I'm thinking, a high possibility that we might need to have surgery, because it looks as though it could be a case that the bowels come out and twisted, which is why it's not going back in, and obviously if it's twisted up, it's really dangerous. She had some morphine through her IV, which took the pain away a little bit, and then when the doctor came in, obviously he was poking her tummy so gently as well on the really painful bit, but it just made her pain off the scale, so she's just had more IV morphine, but she's like shaking. I'll show you guys. But yeah, so she's shaking and not really doing very well, but yeah, so we're going to be heading up to the surgical assessment unit shortly, and we'll keep you updated again. So, as you guys can see, this, which is normally flat, like that, that is Charlie's hernia. It's usually just this piece, which Charlie can pop back in, but she can't pop it back in, and it's expanded all the way up, and it's basically going into her chest now. So as you can see, it's just getting bigger and bigger, and she can't get it back in. And you can tell that she's in a lot of pain because A, her leg's jiggling, and B, just look at her face. Just getting redder by the minute. Just hope that they hurry up and look at her and that they get it sorted out. I mean, we've said, haven't we, babe, that even if it's like a surgery situation, we just want it sorted now. Because it's not on that it's been left this long. I mean, look, guys, it's getting bigger already. I don't know if you can see that, but yeah, so we'll keep you updated. Hi guys, so we've been up at the surgical assessment unit for a while. We saw one surgeon who was a bit of an ass, but she ended up having a bit of pain relief, and then another surgeon came in and he was lovely. And basically it seems like the plan is going to be basically going to be that she's going to have, more than likely have surgery to fix it, and then hopefully that will work. He's prescribed more IV morphine because the pain relief that the other surgeon gave was paracetamol and Oromorph, which, for people who don't know, Oromorph is not as good. It barely touches it, especially seeing as she has it at home. But yeah, so I just thought we'd update you guys and let you guys know. So we'll speak to you later. So guys, to update you all, I'm at Mum and Dad's now, and while here, the nice surgeon rang me to let me know that basically she's going to be having an operation within the next hour to have her hernia fixed and the blockage removed. What, Mum?
Sorry, Karen.
Okay.
That's just all.
Okay. Look at these little babies. But yeah, so she's going to be having surgery, but we're really pleased about that because she's been having problems with this hernia for a year. And although it's really scary because of how she does with surgeries and anaesthetics and stuff, obviously she even said that she would rather have surgery, whereas like for her hip stuff, she was just like, it's not worth the risk, or like the anaesthetic stuff, it's not worth that. Whereas with this, she was just, I just want surgery. So we're glad that that's happening. As you can probably tell, can you tell? I don't know. I've been crying because when on the phone to the surgeon, I forgot to tell him to ask him to tell Charlie that I love her, and so I rang back the ward and spoke to her nurse. I was just like, can you please do me a huge favour and tell Charlie that I love her, but then can you also do me another favour and ask, what have you lost? You put it on the table. And then I said, can you do me another favour and ask her, like, say to her, if she goes catatonic after this one, which for people who don't know is basically unresponsive, she can still breathe and stuff on her own. So it's not like she's not like in a coma, but she's unresponsive. And I said to ask the nurse to say to her that if she's like that, is she cool if I don't come in and save my visit in for tomorrow? Instead, like when she can be a little bit more, like actually hopefully be awake by then. Because obviously by the time we get from Mum and Dad's to the hospital, she probably would have already been like either just gone down to surgery, or like it would be like 10 minutes and then she'd be going down to surgery. And then obviously we don't really want to be sat there for an hour waiting for the surgery, because I've been in that situation, sat in the hospital waiting for surgeries before, and because she's not like woken up properly, it's been horrific, because we've just been sat in the hospital not getting answers, and it was horrible. Whereas at least here I can be with the girls who haven't stopped hugging me and kissing me since I started crying. I just want to say it's really adorable, even though they're really hot, bless them. But yeah, so she went and said that to Charlie, and Charlie agreed. And I don't know if we've mentioned it, we probably have, but if I say to Charlie, I love you, she'll say good in return, and just that good is Charlie saying, "I love you too," and you know I love you too. And it's just sort of like every time I go out anywhere, or like she goes out anywhere, I'll tell her that I love her and she'll say good, and that's just like, that's just our thing. When the nurse came back on the phone to let me know that Charlie said that yeah, that's fine if she was to go catatonic, don't worry about coming in, because it would stress me out, and she wouldn't benefit from me being there, kind of thing. So when the nurse came back to the phone, she said that she told her that I loved her, and that she said to say back good, and that I'd know what that meant, and that at that point I cried, because that was just really nice to hear, because that's our little thing. And obviously until look at that, until like all day really, she's been in so much pain that she's been crying and shaking, and her jaw's been going and like shivering sort of thing, but not through cold, but through like adrenaline and pain and stuff. So it was nice to hear her say good, even though it wasn't her that actually mouthed it, but she said it to the nurse to say to me, and that was lovely, and that just made me cry, because I haven't cried yet. And I'm a really emotional person, as I'm sure you guys already know. But I was trying to be strong for Charlie, because obviously it's what you do in these situations, isn't it? You've got to be the strong one, because they're going through pain and they're scared, so, you know, all of that sort of stuff. But, yeah, so she's going to be having surgery in, by now it's probably about half an hour. I don't know how long I've been chatting to people. In half an hour. Sorry, that was just Mum coming in with like 2 pizzas and just like, "Do you want this and chips for tea?" And I was just like, yeah. But yeah, so she's going to be having surgery in about an hour. It's going to take about an hour if it goes well. And I will obviously be updating you guys after that. Obviously, I know that this is all in the video, that's the day after all of this has happened, but I'm sure you guys can understand that I can't, there's no way that I can do the vlog and get it uploaded early enough for you to see it the same day that it's happening, kind of thing, especially seeing as I've got to try and edit it and sort it out and stuff, and I'm not an editor or a sort it outer. So I will speak to you guys later. And for now, I'm just gonna sit and chill and try not to cry anymore. Hi guys, so it's 8 o'clock and Charlie was supposed to have gone down for surgery at about 6 and then been finished at about 7, and she's not gone down to surgery yet. She's got one of those, I don't know what they're called, but like one of those things that if you're in pain you press a button and it gives you a bit of pain relief, which sort of helps you, like it takes off the edge. She's got one of those in, so she's happy. Well, I say happy, but she's not in that excruciating pain and stuff that she was in earlier, which is good. So I just rung up and they've said that they're imminently coming to take her down, so it's 8 now. They'll probably get her down there about 8:30, hopefully, and then I'll probably ring up at about 10ish and see if there's an update, which means that we won't be going in more than likely, because that's really late to be going in. I mean,
Should be sleeping anyway.
yeah, I mean, I don't think it's going to be a case of that we will be going to see her again tonight. I think it'll be a case of we'll go to see her tomorrow. But yeah, so that's the latest update, and I've got a cute little Albert Bob like this, look, leaning on my army peg. And I'll turn the camera around in a second and show you Dixie. Yeah, so I will update you again later at approximately 10ish. I think that's what I said. If not, then I'll update you at the time that I said, because I just calculated it, and now I've forgotten. Okay. So guys, this bag was on that chair, and somebody wanted to sit on that chair. So they sat on that chair and then curled themselves around the entire bag and was just like, I am not comfortable, but I'm staying with it. And then I was just like, okay, I think I might move the bag. And now look at her, she's just so cute. She always sleeps on this chair, doesn't she, Mum? Mm-hmm. Yeah, she really likes this chair. I don't know if it's because it was in the house when she was a puppy or not.
It's the cat's chair there.
Yeah, well, yeah, that's true. Yeah, Poppy used to sleep on it, didn't she? It's funny, really. But yeah, she's super cute. And she's still super cute. Look at that. Look at her. Oh, so squishy. How you doing?
Milkshake.
She's doing milkshake. That's lovely. Right, so she's got this little pump doohickey that's
That one feeds pain relief straight.
yeah, straight into her tummy, which is over there. And what? I know, I need to show
Anatomy
you.
lesson.
Well, you never know. That one is, what was that one? Can't remember. Mind blank.
What one?
This thing.
PCA.
Oh yeah, that's her.
Patient-controlled analgesia.
Yep. So pain relief. We just bought her a milkshake and loads of. What do you do? Flick it?
Yeah.
And loads of drinks so that she's set. Chocolates. But yeah, so she's doing pretty well. And she's got a drain, yeah. She's draining from her belly. And you showing them. Yeah. Warning, potential grossness.
Keep your dignity, young man.
Yeah, so those little wires there are the pain relieving ones.
And then there's
There's that, which is the drain.
drain that goes there.
Yeah.
It's about that
Yeah.
wide. The cut is.
Yeah. And on her legs, she's got these really cool things that blow up to, like they don't like continually blow up, but like they blow up and they're released to sort of relieve pressure so that you don't get clots.
My nasal cannula tickles my brain. You ready for this?
Yes. Is it still going? Oh my god, that's massive. Hang on, I need to show the people how long that is. Like, put it back in again. Bearing in mind what it's normally like, guys. How long are they? And it's really straight as well.
Yeah.
At least it stays in.
It's the only ones that do stay. They chucked my other ones from my chair because the nurse thought they were dirty.
To be fair, they did have something in there. I noticed it last night.
Oh, wheelchair ones.
Yeah, but it did have something in there. Which I don't know what it was. But yeah. So yay, you're doing alright, aren't we, babe? Yay.
Morphine every 5 minutes.
Yeah. Providing that they hurry up and put some more in. But yeah, so we've been here for a while and we're about to leave. And yeah, we'll try and keep the people updated. I mean, this part of the vlog, I'm tempted, because I've not finished the other one, I'm tempted to just pop this on the end of that one and have it as like a long sort of, this is what's happened. But yeah, beautiful. Good night, everyone.